I'm here with Dr. Alyssa Misener, who's with Bayview Optometry here in Kingston, Ontario. Hi, Dr. Alyssa.
Hello.
I had a couple of questions for you. As somebody who wears glasses and used to wear contacts, there's a lot going around about the hygiene, the facial hygiene, the hand washing, all of that. It occurs to me that when it comes to eye care, there's definitely some things we have to take into account when hand washing and the eyes being a potential point of entry for any virus. Should people even be wearing contact lenses during this?
Yeah, so great question. I know initially there was a lot of confusion about, should we be wearing lenses? Should we not be wearing contact lenses? And luckily for all of the contact lens wearers out there, most recent studies have shown us that contact lens use and wearing, there's no increased risk of developing COVID versus, let's say, somebody like yourself who's currently wearing glasses.
So what precautions should people be taking in terms of the hygiene anyways, just to be safe?
Yeah, so firstly, hand hygiene, first and foremost, is the most important factor. So obviously washing your hands with ideally soap and water, and then a paper towel to dry them off would be the best option.
As a former contact lens wearer, I have a horror story that many have had involving chopping jalapenos, washing the hands several times, and then attempting to install my contact lenses. I still remember that event not fondly. With hand sanitizers and soaps and whatnot, should people be taking a little bit extra care as to what they're using as a soap and a hand sanitizer?
Absolutely. So the best thing truly is warm water and just regular hand soap. I understand that there might be certain times where, hand sanitizers might be more convenient, but we do try to encourage people, water and soap, and make sure your hands are dry. Obviously, with your experience, not initially the best, but I'm sure if you talk to most contact lens wearers out there, somebody's had some type of similar story that they would really love to forget. But yes, warm water and soap, ideally the best.
And it goes back to hand washing, obviously, that you have to really do it well anyways if you're wearing contact lenses. What about contact lenses not being the only potential contamination point? What about people who use eye drops? Would it be, for example, a good idea to maybe go to using the disposable ampules that are, have a few drops in each?
Yeah, so that's a really great option, kind of like those one-use eye drops. That would be a great option. Unfortunately, not all eye drops on the market are kind of formulated for that or packaged like that. So some people, especially right now during the peak of the allergy season, are kind of reaching for those over-the-counter or prescription allergy drops to help kind of alleviate their symptoms. So again, obviously hand washing whenever we touch our eyes or anywhere near our eyes, that is kind of the biggest concern, is that you have clean, dry hands. The next biggest culprit potentially for any type of contamination would actually be the eye drop bottle itself. So your eyelids or even your eyelashes potentially touching the tip of the bottle or your finger touching the bottle could be a point of contamination. So trying to avoid that would be the best. Obviously, if you've instilled eye drops, it's not the easiest task. So, it definitely takes a lot of practice and patience. But trying to avoid, yes, again, touching your face as well as the bottle dropper itself.
Moving on, I know that a lot of, it was reported that there was something like 60% drop in people going to the emergency room, even when they had symptoms that should have been looked after. I know a lot of people are probably thinking that their doctors or optometrists, their dentists are closed and not taking patients. What does somebody do if they have a regular optometrist and they've got some concerns? Or if they have an appointment scheduled during this, and should they put it off? Are the offices open? Are people in business?
Sure. So the fact that there has been a little bit of a decline in the number of people, presenting to the emergency room, is great because on part, in one sense, we've done our job as well as kind of the health practitioners. The Ministry of Health has done their job in terms of communicating to people, stay home. And we do encourage people to contact us. We are an essential service. We are open for business. However, there is some limitation on what we can see. And so we are unfortunately limited to seeing urgent care only. However, we are answering our phones, we are answering our emails daily. So we do encourage, if you have a healthcare practitioner, specifically an eye care practitioner here, local to be Kingston or wherever that may be, please reach out to us. We are here to help you. Unfortunately, in Kingston, there aren't a lot of optometrists locally who are seeing patients due to the lack or shortage of PPE. So what's happening is that we are having to triage those patients and determine whether or not what they're experiencing truly needs to be seen. And if so, we can make arrangements for them to have an appointment or head on down to Hotel Dieu, where somebody will be able to meet them or see them there almost on an appointment basis rather than sitting in the emergency room, or to somebody else locally, like a local ophthalmologist who does have the proper PPE available to them.
So in other words, people shouldn't risk their health if they've got something they're concerned about. They should look into it at the very least to call their optometrist, dentist, doctor, whatever.
Absolutely. So we all have some type of form of communication, whether it be phone systems and messages or emails, that we are here to help. And we do really encourage our patients to reach out to us, if nothing else, to provide reassurance that their eye issue or concern that they're experiencing truly is not worrisome, or heaven forbid if it is, that we can redirect them in the appropriate area.
And obviously enough, if somebody, for example, doesn't wear contacts and smashes their glasses, they could call their optometrist and get a new set of glasses made up or a new prescription or whatever over the phone if necessary.
So, that seems to be a slightly more difficult, not that it's not doable, but unfortunately, again, let's say, if you were to use your glasses or require your glasses to drive, then that definitely is something that we would maybe be able to figure something out in a sense of, repair the frame or do something to it or the lenses to kind of tie you over until we're in a position where we can really, truly reopen to the full extent of our business. But again, reach out to us. We'll see what we can do. Sometimes it's just a matter of calling the frame company to order a replacement that's possibly even under warranty. So please reach out to us. I know every office is a little bit different, but we're here.
Okay. And I guess the last question, the most important question, how are you doing, and how are things at the clinic, and how are you getting through this?
We're doing the best that we can. I think that, unprecedented times, we do our best. We're all really eager, I'll say, to kind of go back to work, to get back to this, new normal, whatever that may be, and to start seeing our patients. We do see our patients often, some of them, once a year, others every few years, but we are quite eager and we're doing the best that we can. But we are looking to, reopen, obviously with some modifications in place. The hardest part for us is going to be, establishing that balance between ensuring that our patients are still getting that quality eye care that they've always been after, but also from a safety perspective, that our patients, us as doctors, as well as our staff, are safe, and that we won't be contributing to that second or third potential wave that we're all, just anticipating in some sense and hoping that it may not happen. But that's kind of the biggest challenge that we've been. Now we don't have a reopening point. At this point, we haven't been given a date. we're hopefully anticipating within the next few weeks or so, but it's just uncertain at this point in time.
But again, even if you're not reopening per se, if somebody has questions, don't hesitate to call their optometrist.
Yes, absolutely. Please reach out to us. Like I said, if we can't personally see you, we can find somebody who would be able to see you if it is deemed urgent, and nonetheless just provide some reassurance for you guys.
Okay, Dr. Alyssa Misener, thank you for this, and stay safe.
You too. Take care.